So aortic stenosis is an extremely common valvular problem of the heart. The aortic valve is the last gateway between the heart and the rest of the body, so all the blood passes through there. And typically as people age, the aortic valve will narrow significantly. If it gets to a critical degree, then that valve needs to be replaced, and patients start to feel quite unwell. They can't breathe, they can't do much, they get chest pain, they get lightheaded. It really dramatically impacts their quality of life. So aortic stenosis is really usually a slowly progressive disease process. The valve doesn't just narrow one day and you wake up feeling badly. So it's a slow onset. And so what people generally recognize is gradually increasing fatigue, shortness of breath with activities, occasionally lightheadedness or even passing out spells, can be chest discomfort. And all these things get worse and worse and worse slowly over time to the point that people just become incapacitated. Historically, patients have been treated typically one way and one way only, and that's with open heart surgery. Unfortunately, a lot of people that have this disease are elderly or have multiple other medical problems, and those people don't typically get offered surgery. They succumb to their disease and die. The number of patients that are currently not eligible for surgery is a bit of a floating number, but as many as a third of people with this disease just simply are at too high a risk to undergo conventional surgery. So we're thrilled to be involved in a new trial that offers patients that are at high risk for surgery for aortic valve stenosis to receive a valve through a percutaneous approach, which basically means we can do it through a delivery through the skin rather than actually opening the chest to deliver the valve. So for patients that have aortic stenosis, have other medical problems, or are advanced in their age, this is an opportunity for them to get treatment that they otherwise might not have and allow them to enjoy the rest of their life with relatively good quality. So like many other vascular procedures that we've turned into minimally invasive surgeries, this works in a similar fashion. So the valve itself is actually mounted inside of a stent. And stents we use for the heart, we use for aneurysms, a variety of problems in the legs. It just essentially is a wire mesh tube, and inside of it we've, not we, but manufacturers have sewn the valve leaflets inside of the stent. So the delivery is through a portal in the femoral artery, so it's a puncture in the femoral artery. It's delivered through a catheter up and around into the valve position. We do a little valvuloplasty, a little dilation of the valve to prepare the patient's own aortic valve to receive this. But it's basically positioned across the aortic valve and then slowly deployed in that position, and it immediately starts working. Well, the patient that has traditional open heart valve surgery, they're in the hospital for typically about 5 days, and then there's several weeks of recovery afterward. The patients that we're studying in this trial, though, are patients that are typically at a much higher risk of dying from that same surgery. So they typically have at least a 15% or greater chance of death from open surgery and about a 50% chance of major complication. So the hope here is that by delivering the valve through a less invasive approach, that we can eliminate a lot of that morbidity and a lot of that mortality, and certainly what we've seen from our European colleagues is that that has been the case. So the CoreValve device that we're using is not currently approved for use in the U.S. except for in studies like the one we're talking about, but it is approved for use in Europe, and so there have been actually 13,000 implants in Europe, and the results have been quite astounding. So patients with aortic stenosis obviously need to see either their primary care doctor or a cardiologist in order to be properly evaluated. But patients that are recognized early on as higher risk for general surgery certainly can be referred into this trial through our trials department here in the hospital. Yeah, so the bottom line with this technology is it's really the most important advance in the cardiac field, in my opinion, in the last 20 years. I mean, equally as groundbreaking as the stent was and what that did to how we treated coronary disease, I think that going forward, this type of technology will revolutionize how we treat valvular disease. So it's, it's fun to be a physician living in this era. It's great to be a patient that, has this type of problem because the options are now, opening up to them.